This is the first narration that covers topical, over-the-counter, and things like that. All right, so first we're going to talk about topical dermatologic drugs, and we're going to talk a little bit about most of these, but just take a note of this list. Look at this and see that all of these are topicals, and you've probably used a lot of them. We'll go into more detail on some of them, and then others are going to be, just like later on in the course, we'll talk about some of them. All right, so antibacterial drugs. We've got, here we've got antibiotics that are formulated as creams or ointments or something like that. A lot of these are over the counter. We've talked about bacitracin, neomycin, polymyxin. Those are the antibiotics that are in polysporin, and then 2 of the 3 are in neosporin. I always forget which 2 though. And then we have the mupirocin, which is under the brand name Bactroban. This is a prescription drug. It is used for MRSA. It is, I forgot to mention this in class, but it is becoming a little bit resistant, or MRSA is becoming resistant to it. Some MRSA is. However, it still kills a lot of it. And what we do is, for anybody who has MRSA in their nares, or anybody who is, because if they have MRSA in their nares, we're going to treat it. But if they are going to have surgery, we put it in their nares like twice a day. And that way, if they do rub their nose and then scratch at their surgical incision, they don't move MRSA into it. Last one in this category that you need to know is silver sulfadiazine. This is marketed under the brand name Silvadene. And we put this on burns, not first-degree burns that don't break the skin. Okay, this is not something you would get for a sunburn. Use some aloe vera with lidocaine that moisturizes and numbs, okay? But this one actually helps prevent infection in burns. When you have a 2nd or 3rd degree burn, it is open. And so you've disrupted the skin integrity. Remember that innate barrier to infection that we have. It will cause some burning and itching at the site when it's put on. For a lot of people, they tend to get used to it. But silver is antimicrobial, like I was saying in class. And then it also has a sulfa drug in it that is antimicrobial. So one of the things that you have to note about this is that you cannot give it to people who are allergic to sulfa drugs. Anti-acne drugs, these are another type of antimicrobial drugs. Lots of them are over the counter, specifically benzoyl peroxide. One of the ones I didn't mention in class is actually salicylic acid, which is the reason that is used for acne is because it dries up the oil and then also kills some of the bacteria. And then things that are prescription include erythromycin. Anything ending in mycin is an antibiotic. Tetracycline, remember that we don't use that in kids because it stains their teeth. Clindamycin, which is that's actually also available as a cream that people put on their faces wherever they have acne. And then we talked about vitamin A acid or retinoic acid, and that is marketed under the name Retin-A. And that is a cream. I don't know if I said that in class. Retin-A is a cream that comes in different strengths. A lot of these, so like clindamycin comes PO and cream. Typically, though, and erythromycin comes in a cream, I think, too. Typically, though, when it's for acne, they don't take pills, okay? If somebody has really bad acne, they will move to tablets, antibiotic tablets, okay? If you are on some of them, you need to have oral contraceptive pills, okay? That's what OCP stands for. Specifically, Accutane or isotretinoin. So Accutane was what this was originally marketed as. Some other company makes it now, so it's not called Accutane anymore. And this is the one that you have to sign something that says that you promise you'll use 2 forms of contraceptives. So everybody will be on birth control pills for that, and then they're told to also use condoms. So side effects for anti-acne drugs typically are redness and drying. So that would just be local inflammation. Sometimes it'll cause like peeling skin, okay? And typically with that, they just tell them to use them less often when it's something like that. All right, fungal infections. So we've talked about antibacterial. Now we're going to talk about antifungal. All of these end in Zol, and that is true. I can't think of any examples to it. But that's also true of PO antifungal tablets. So those will also end in Zol. But to here, and we'll talk about those actually next semester is when we're going to talk about those. For right now, we're just going to talk about the creams or ointments, be that as it may, or suppositories. They come in that way for yeast infections. Topical fungal infections are really hard to get rid of. So if you have like athlete's foot, or which is tinea pedis is the name for that, Pedis. Tinea is typically like the athlete's foot type thing. Candida albicans is a yeast infection. Clotrimazole is marketed under the name Lotrimin, and that does come as a cream. It also comes as a spray, if I remember correctly. Miconazole comes as cream and suppositories. That's the one that's typically used for yeast infections. It's marketed under the name Monistat. All right, and then topical antiviral drugs. Remember, if it's a viral drug, it always has VIR in it. But remember that VIR is going to be your it's antiviral, but it could be used for cold sores or it could be used for HIV because they're both viruses. So Zovirax and Denavir are both used to treat HSV 1 and 2 and HPV. Note that they don't cure them. All it does is put the virus into dormancy, and then once the virus is dormant and there's no more open sores, you aren't contagious anymore. And so typically they will reduce the symptoms as well, and make it heal faster. It's often better to take these PO than it is topically. I think there is one over the counter. I meant to look it up, although somebody said it's Abreva, and I don't remember what the brand name is of Abreva, but a lot of times if somebody has a cold sore outbreak, they will use like acyclovir cream, or that's Zovirax. So, all right. Topical anesthetic drugs. Remember that anesthetics will typically end in cane. Cane is basically anything that numbs you. So we use this for Novocaine, we use benzocaine, we use lidocaine, anything that ends in cane, and we inject it. So we inject lidocaine into surgical sites. Like I had something on my finger that needed to be removed. Thought it was a wart, wasn't a wart. But it was actually a piece of bone, which is super weird. But anyway, so they numbed my finger with lidocaine, and then they dug it out. So the dentist uses Novocaine. Novocaine is an injection. They also use a topical Novocaine, which I talked about at least one of the days in class. I don't remember. But we have, it's like a little soaked cotton swab that you put in your mouth, and it sits and it numbs you before they inject the actual lidocaine or Novocaine into your cheek or your gum or whatever. All right, topical anti-itch medications. Pruritus is itching. So anti-itch medicines come in two forms. It can either be a steroid or it can be an antihistamine. And note that both of those come as PO and topicals. So we have, and when we're talking about the topicals, like Benadryl, for example, is a topical antihistamine. Diphenhydramine. Usually things that end in "ene" are antihistamines, but it's not 100%. Okay, so just because it ends in "ene" doesn't necessarily mean it. But most of your antihistamines will end in "ine". So diphenhydramine, which is Benadryl, is over the counter. It comes as tablets. It, by the way, it's also the active ingredient in Sominex, which is because it causes drowsiness, because it's a first generation antihistamine, and all of those cause drowsiness. There are a couple more, like chlorpheniramine is one of them, for example. But the topical form of Benadryl comes as a cream. It also comes as a spray. I think I've seen it. Now, corticosteroids, your steroids are over the counter. For topical, we have hydrocortisone. Comes in 0.5 and 1%. It does come as high as 2.5%. No, you don't need to know that, but that's a prescription dose of hydrocortisone. And again, anything that ends in "one" is probably a steroid. Sone or Solone are going to be your steroids, okay? So the steroid does help with the itching because it suppresses the whole part of inflammation. So it's also going to reduce the swelling because it vasoconstricts your blood vessels, and so that leads to less of the inflammatory factors being at the site. So if you get bitten by a bug, best thing to do is actually to mix together a little bit of Benadryl and a little bit of hydrocortisone and put it on there. All right, speaking of bugs, and not the kind of bugs that, fly around like mosquitoes. These bugs are lice and scabies. So these are fun. I was going to put a picture of these of a louse. Lice is plural for louse. But I didn't. Anyway, so lice sits in the hair, scabies are on your skin. Lindane is prescription. That does come as a lotion for scabies, as a shampoo for lice. And then permethrin is Nix. That is over the counter. It is just a shampoo. Important thing about lice is making sure you comb the hair to get all the eggs out. Those are called nits. And they're white, I think. I don't know, or maybe they're like a clearish white. I don't know. I've never actually seen them in person, and I'm okay with that. All right, finally, some wound care drugs. We know through research now that vitamin C is necessary for wound healing. And often we combine zinc with that. We typically give it PO. It boosts the immune system. A lot of your immune system boosting drugs that you see, like Emergen-C, the reason it's called Emergen-C is because it has vitamin C in it. I think it also has zinc in it, but I could be wrong. Airborne, Coldies. I know Coldies is zinc, okay? And those really, they were kind of a fad thing for a while, but we really do have research that supports the fact that you need vitamin C and zinc for your immune system. So, some of the topical wound care drugs that you're going to see in practice include Dakin's solution, which is a very, very, very small concentration of bleach, but you can smell the bleach in it. And collagenase, which is appropriate for people on anticoagulants. Now, Dakin's is not appropriate for people on anticoagulants. So Dakin's solution has the bleach. It's not really safe for people on anticoagulants, can induce more bleeding, but it is a nice debridement. It's a little bit antibacterial and things like that because of the bleach. Collagenase actually supports the growth of granulation tissue, which is what we want in a wound. Okay, we want that to grow, or we want granulation tissue because that's the new tissue that's coming up. But it's appropriate for somebody on anticoagulants. All right, these questions, I will go through these. We did go through them in both my classes, and then this will be the end of this narration. I think there might be one more slide. All right, question one: a woman who's taking isotretinoin calls the office to say she thinks she might be pregnant. What will the nurse instruct the patient to do first? Pause, answer the question to yourself, and hopefully you said stop it. Yes, definitely stop it, and then consult an obstetrician. Okay, that would be step 2. But it says, what do you do first? Probably they're just going to switch her to something else. Okay, but she cannot take isotretinoin if she's pregnant. And then they're going to be like, weren't you using 2 forms of birth control? All right, the nurse is assessing a patient who's been diagnosed with MRSA on the right arm. It's probably a community-acquired MRSA, which is probably not resistant to a lot of the antibiotics yet. And you can get community-acquired MRSA just about everywhere. So what does the nurse anticipate use of? Pause. Answer it to yourself. And hopefully you said mupirocin or Bactroban, and that is a prescription product. The other 3 are the ingredients in polysporin. The patient has an infected stage 2 pressure ulcer that contains some necrotic tissue and some normal healing granulation tissue. Patient is taking warfarin, which is a blood thinner. Which product would be most appropriate for wound care? Easy one there. That's Santyl or collagenase or collagenase. I don't know how to pronounce it. All right, that is it on those. And, oh, nope, I do have a couple more slides. All right, skin prep for surgery. We used to use alcohol. We don't anymore because now we have better stuff that actually kills stuff. We will still use alcohol when we're doing very simple things like drawing your blood. However, if we're doing surgery, we use either chlorhexidine, which is actually for the patient because it comes in a shampoo/shower gel. And I'm being sarcastic when I say shower gel, but It's very medicinal, but patients are instructed to wash their. Some patients are actually told to wash their hair, but most people it's wash their body. And I mean, clearly it would depend on where your surgery is. I had somebody who was going down for like a neck surgery, and she was told to wash her hair with it as well. So, but if you're going down for like leg surgery, you're not gonna have to wash your hair probably. But anyway, typically it's the night before and then the morning of surgery. When my dad had his back surgery, he was sent home with a bottle because an outpatient admission for surgery, an elective surgery. So he he took a shower the night before and the morning of with it. That's chlorhexidine, brand name Hibiclens. Excuse me. Still haven't quite gotten rid of this cough. Chlorhexidine also comes as a mouthwash. We use it for gingivitis. And then betadine, or the povidone iodine solution, this is what they paint the skin with. And then as it dries, it kills everything on the skin. And so that's that yellow stain that you'll see on people after they've had surgery. And this is just the incision site, okay? If your patient is allergic to shellfish, they will break out into a rash from this. So that's something that we always ask them. All right, let's see. We have Jane. She is 17, being seen in the derm clinic for treatment of acne. The NP prescribes benzoyl peroxide topically 4 times a day. Jane wants it to go away more frequently because prom's coming up, maybe. So the acne will go away quickly. What do you say to Jane? Pause. Answer it to yourself. And the answer is C. Overuse of this drug can result in painful reddened skin. So, B, the benzoyl peroxide does not exist as a pill. Whoops, I didn't mean to do that. Okay, there we go. All right, a few months later, it's determined it's not working. So now she's going to go on isotretinoin. What do you teach her about here? Pause, answer it to yourself. All right, so we talked about in class how people who have been on this had to take all these surveys all the time asking whether or not they were suicidal. It does cause depression in some people. However, I didn't mention that in the first slide on it. And so, but you can look at these and knowing what you know about isotretinoin, which was the old Accutane, you can answer this. So if you become pregnant, the dose of isotretinoin will be cut in half. No, we stop it completely. Just because you take a lower dose of a teratogen doesn't mean that it's no longer a teratogen. Should not be used with any form of birth control. Nope, they have to use 2 forms. And then administered by subcutaneous injection directly into the acne areas. We don't inject medicine into our pimples, okay? So no facial shots. All right, during a regular follow-up visit, Jane points to a sore that she has developed on her mouth. She's diagnosed with HSV, herpes. Which medication do you anticipate Jane will receive? Look for the Veer, acyclovir or Zovirax, either PO or as a cream. Miconazole and clotrimazole, those are both antifungals. They end in zole, and I don't know what the last one is. And that's it for this narration. The next one we'll pick up talking about eyeballs.